I've always been interested in healthcare. I trained as a nurse many years ago, and the interesting thing for me was always trying to get to the end of what can I do to actually prevent people having time in an acute hospital? What can we do earlier to advance people's health and stop them becoming ill?
I wanted to bring difference in efficiencies, in service levels, etc., and ultimately get the best from a patient's outcome perspective.
The reason I moved into health is because actually it's really innovative and is changing and is dynamic. What we've seen recently is some of the traditional players are facing a lot of challenges. And so what that means is that the landscape is ripe for new entrants.
I'm a doctor by background, so I spent all my life in healthcare, initially as a practicing doctor, and I still see patients now. But when I became head of a department, I realized that I could contribute quite a lot on improving the management of health.
I've always had a genuine passion for working in healthcare. My mother was a nurse. She came to England in the 1960s and worked in the healthcare sector, saving lives and caring for others. And that from a very young age instilled that passion in me.
What motivated me to work in health and specifically pharmaceuticals was my career as an engineer. I started off originally in the oil industry, building oil refineries and chemical plants, but then really wanted to do something that would improve the health of individuals.
Prior to joining PwC, I was a nurse. I'd worked as a nurse in accident emergency, medical admissions, and the reason for going into nursing was I really like working with people.
Patients are also consumers, and they're starting to think about their healthcare in the same way as they think about buying groceries or buying clothes, and thinking about how the new models of care and new forms of delivery are changing with a slightly more consumer-type mindset is really interesting for healthcare.
My past experience in the aviation sector, in particular with Rolls-Royce, was based around the movement of materials through the supply chain to make sure that those materials ended up at the end customer. This is applicable in the health sector as we move life-saving drugs and technologies.
So I can actually tell my clients, listen, I've been there. And that's particularly important as we go from strategy through to execution. I know what it's like to implement some of these strategies.
I've been really fortunate that I've been able to work across the whole of the healthcare system with the Department of Health, a number of the arm's length bodies and providers. And outside of PwC, I'm a lay board member at Leeds Teaching Hospitals.
Within my clinical practice, I'm very aware of innovation and new scientific breakthroughs all the time. When I look at my practice within the hospital and the clinic settings, then lots of things have stayed the same for the last 30 years. So I want to help that the same innovation in analytics and so on comes through in the whole delivery of healthcare, including the clinic setting.
The other thing that I love doing is working on really some of the huge health issues facing us today. So we've done a lot of interesting work in dementia, work in antimicrobial resistance, and recently we've won a few projects in HIV.
I personally really enjoy helping people through difficult periods, but also on top of that, having been a nurse, my focus on the patients is something that's always with me, and it's also something I really try to instill in my teams as well.
My previous experience in the health sector helps me understand the challenges that people are facing every day. By bringing the best of what we've got to offer to people, making complex problems broken down into simple bits, getting rid of the gobbledygook and actually getting down, rolling our sleeves up and working things out together, it gives me the best chance I can of actually helping to sustain something which is a source of national pride.